Hi, I'm Dr. Girish Rao. How long does the implant surgery take? The surgery is a very minor procedure, which is, as I told you earlier, can be done under local anesthesia. Usually within about an hour, we can, do the full arch rehabilitation with the surgical phase of the implant. That is where we basically make a small slit in the gum and then maybe sometimes trim the bone because if there is irregularities, and then make it into a plateau and then place these implants in. It would be within about an hour or maximum 2 for the surgical phase, and the gum is put back by using some sutures. Now the healing of this would take probably a week or so, and then we wait for the implants to get integrated into the jaw. In the lower jaw, when the implants are placed, it can be about 3 months. In the upper jaw, it can be 6 months. But having said that, if the implant binds into the bone with a good amount of force, we call as the initial stability of the implant is very good, then we can do what's called as an immediate loading. That means that a crown or a bridge or a denture can be clipped onto these implants on the same day itself. That is the concept of what is called as jaw in a day or tooth in a day. A lot of people ask me, are implants expensive? I would say yes and no. If we look at the quality of life which we can actually transform with dental implants, yes, then implants are not expensive at all. But quality comes at a price. If you have to get good implants, which are standard implants, to some extent it is expensive, I would say, especially when we are doing full mouth rehabilitations. But compared to a lot of other countries, the Western world, the US or Australia, Canada, implants are very, very affordable in India, I would say. These are high quality implants, the same ones which you get anywhere in the world. We do have the same ones over here. The same companies are also marketing implants in India. And I think it's extremely affordable in India to get these things done over here. What are the latest things which are happening in dental implants? One of the game changer, I would say, is what is called as a tooth in a day concept. This I have been practicing at Mocha Facial Surgery for the last 20 years, ever since I came back from England. This is a concept where you come in with a broken tooth or a tooth is infected, we pull the tooth out, we clean the socket, and if the bone is good, we immediately place an implant. And if the binding of the implant to the bone is good, that means that the primary stability is good, we are able to give you a crown or a denture or a bridge on the same day. That concept is called as tooth in a day. This is extremely useful, especially when you have one or multiple teeth in the front aspect of your jaws missing. It is a game changer, I would say. The other thing which I have been practicing is for people who have had cancers. Now, mouth cancer is very, very common in India, and we have resected the jaws, we have reconstructed it using bone from the leg, and in such kind of cases, we can put dental implants too. Now, this we can help in fixing teeth onto the leg bone, or it could be the hip bone, which is now replacing your lost jaw. Now, that is a game changer, and that concept is extremely useful in terms of rehabilitating our patients with mouth cancer. So that is another new thing which is there. Some of the other innovations which we have done is what is called as virtual surgical planning, or doing surgical planning based on computers. So we actually work backwards. We look at where the tooth position is, print that tooth position using digital dentistry today, digital jaw surgeries, and we are able to get accurate placement beforehand itself, which we plan on software based planning, and that's called as virtual surgical planning. And to this we can bring in precision so that when we place the implant, we've already printed a bridge and that can be fitted instantaneously. So the precision is something which we are working on, and we have been able to achieve it in a very, very big way. So that is again a game changer in dental implants. What is the aftercare and maintenance following dental implants? I think the most important thing is the responsibility you as a patient would take following your dental implants. Just like how you take care of your natural teeth, what God has given, brushing twice a day. And it is also important that you see a dentist every 6 months for undergoing professional cleaning. Exactly the same thing has to be done with dental implants too. This requires more care, I would say. Again, you must brush twice a day. This is a mandatory thing. You also need to incorporate a water flosser or a water pick. This is a jet of water which you need to use to clean between the teeth or between the gums and the prosthesis which we have done, the bridge or the overdenture, or it could be even full mouth rehabilitation where all the teeth are replaced with implants. So maintenance is the key, and it is also important that you come in every 6 months for a checkup. Now we do take some x-rays and we assess how much of bone is there around the implant, and if there is a problem where you are losing bone, we can involve ourselves in such a way that we can correct this and regenerate the bone, or at least prevent further bone loss. So this is very, very important. It's not that once you have done the implants you can just forget and go away. It is important that you need to come back for regular follow-ups, so that our goal is to have implants for life. Whenever we place implants, we believe, and that is the kind of passion with which we go in, so that you can have these implants for the rest of your life. So on one side, it is our commitment to give the best quality work and to ensure that it is maintained well. You also need to be 100% committed so that you maintain hygiene and come back to us so that we can pick up any initial problems and nip it in the bud so that you don't have a failure of implant.